Welcome to PRIMO MEDICO Expert Physicians Talk, health explained in an understandable way. In this podcast channel, we talk about selected medical topics in collaboration with leading medical specialists. The following content comes directly from the respective specialist and is presented by a digitally recorded voice, expertly scrutinized, clearly explained. PRIMO MEDICO, health to listen to. Recovering and getting back on your feet after suffering from a very serious illness and then finding your way back into a normal daily routine as much as you possibly can often prove to be a truly massive and difficult challenge. It is exactly for these types of patients that the Bavaria clinic located in Bad Kissingen has specialized itself by offering a very unique and special program known as Saluto Care. Today, we want to introduce to you what it entails, for whom it is suitable, and how it works. Dr. Claudia Siebel will answer these questions. She is the Chief Physician of the Intensive Care Unit at Klinik Bavaria. Dr. Siebel, could you please explain to us what exactly Saluto Care is? What does it all involve?
So, first and foremost, Saluto Care is derived from the concept of salutogenesis. The focus is on the development of health. Saluto Care is the name of our entirely newly constructed ward, and the name itself also serves as the guiding principle, or rather, the overarching theme for this truly exceptional form of rehabilitation. Saluto Care represents an innovative and exclusive rehabilitation concept that our clinic has been providing for approximately 1 year now. We provide comprehensive intensive care rehabilitation within a truly unique and peaceful setting, offering a secure and deeply personal atmosphere that is meticulously tailored to support every single aspect of the individual healing process.
For which types of patients and with what specific medical conditions is Saluto Care truly suitable?
Our Saluto Care is a rehabilitation concept suitable for anyone who, after a severe illness, needs to relearn fundamental abilities such as walking, speaking, and eating, or even breathing independently. These are individuals facing neurological challenges, such as, for instance, strokes or traumatic brain injuries, but also those individuals who, after complicated surgical procedures or due to a severe infection, have spent an extended period in an intensive care unit, and now, on their way back to a life that is as self-determined as possible, they need support and guidance.
How can patients actually come to you? So, do they need a special referral to be seen at Saluto Care?
Unfortunately, the comprehensive services provided by Saluto Care, with their exceptional standard of medical and therapeutic excellence, are currently only available to self-paying individuals. Most often, patients come to us through the initiative of their family members, who consciously decide to bear the full costs incurred themselves. Family members are completely worn out by the rapidly cascading events that occur throughout the entire course of the medical condition. They feel overwhelmed by the constant high noise levels and the total lack of personal privacy found on an acute intensive care unit. That is where the concept of Saluto Care comes in, acting as a vital sanctuary for the individuals who are suffering as well as for their loved ones, offering them a safe space to find some inner peace and begin to look forward to the future with hope once again.
Could you please explain to me how Saluto Care actually works in practice?
We thoroughly examine all medical documentation in advance, and if deemed necessary, we will also establish contact with the acute care facility where the patient is currently receiving treatment. Even patients who are almost completely immobile, who may still require medication to support their circulation, who still need to be mechanically ventilated, and are artificially nourished through a feeding tube, can be cared for at Saluto Care. Saluto Care is equipped with all the capabilities of an intensive care unit, its comprehensive equipment, its cutting-edge technologies, and, above all, its highly qualified and specialized personnel. The big difference is, it doesn't look like an intensive care unit. Technology is hidden behind wood paneling. Each patient is accommodated in a spacious, ecologically certified penthouse. Personal belongings are given space and consideration. The individual biography of each rehabilitation patient, Their personal preferences and inclinations are thoroughly assessed. Family members are welcome to stay within the premises, completely undisturbed, at any time they choose. All therapies are fully oriented in both their number and scope to meet the specific individual needs. What this means is that we develop and create for every single rehabilitation patient a personalized and daily adjusted plan, where all facets of their healing process are thoroughly addressed. Of course, the multiple daily physical and occupational therapy sessions are primarily essential for the rapid improvement of physical deficits. And that is surely the primary motivation behind why so many patients end up choosing Saluto care. But the soul and the psyche must also heal. And this is precisely where the unique character and exclusivity of Saluto care become evident. We provide forest therapy sessions, facilitate shopping and concert experiences, and we incorporate dogs and even horses into our therapeutic programs, to name just a few examples. Our range of services is as diverse as the individuals we assist.
Thank you very much, Dr. Siebel, for your explanations. This has been the Specialist Physician Talk, brought to you by PRIMO MEDICO, which is the premier choice for medical specialists and expert physicians. Thank you very much for taking the time out of your day to listen to our program. For more comprehensive and detailed information concerning the topic of medical specialists, please visit us online at primomedico.com. Join us again next time when we return with our popular segment, which is called Medicine for Your Ears.